Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Taking Lexapro. Here's what to expect in the first week. Lexapro side effects during the first week of use are typically mild at lower doses. When you start taking Lexapro, escitalopram, for depression and/or anxiety, you may experience things like nausea, diarrhea, difficulty sleeping, and drowsiness. /r/n/r/n Your body may need days to weeks to fully adjust to Lexapro. However, if side effects persist beyond 4 to 6 weeks, your healthcare provider might need to adjust your dose. /r/n/r/n In some cases, Lexapro can also worsen depression and increase suicidal thoughts, especially in children and young adults. Speak with your healthcare provider immediately if you experience either of these side effects. /r/n/r/n Images SDI ProductionsrnrnRn. As with all antidepressants, Lexapro has a boxed warning for increased risk of suicidal thinking and behavior in children, teenagers, and young adults taking it for major depressive disorder, MDD, and other psychiatric conditions. /r/n/r/n Lexapro is not approved for use in children under 12 years of age for MDD or children younger than 7 for the treatment of generalized anxiety disorder, GAD. /r/n/r/n When starting Lexapro for depression, you may experience more energy. /r/n/r/n But, because Lexapro is a selective serotonin receptor reuptake inhibitor, SSRI, that works by increasing serotonin levels in the brain, it can trigger side effects. /r/n/r/n Side effects, especially during the first week, are common. It may take a few days to weeks for your body to get used to Lexapro. /r/n/r/n Side effects may include /r/n/r/n Lexapro and other antidepressants may also worsen depression and increase suicidal thoughts, especially in children and young adults. If you have suicidal thoughts after starting Lexapro, speak with your healthcare provider right away. /r/n/r/n Side effects usually occur with higher doses, so you may need a decreased dose if they persist. However, consult your healthcare provider first and never try to adjust your dose on your own. /r/n/r/n Withdrawal can happen when Lexapro is stopped. This can cause :r/n/r/n Always speak with your healthcare provider before stopping any medication. /r/n/r/n Lexapro and other antidepressants usually take a while before you notice any significant changes. /r/n/r/n You may experience improvements in sleep, energy, and appetite within the first 1 to 2 weeks. On average, it takes about 4 to 6 weeks to feel the full effects of Lexapro. /r/n/r/n While Lexapro is generally a well-tolerated medication, some serious side effects can occur. Serotonin syndrome is a rare but potentially life-threatening syndrome that can happen when you have too much serotonin. This usually occurs within 24 hours of having your Lexapro dose increased or if you are given another medication that increases serotonin. /r/n/r/n The following are common signs of serotonin syndrome. /r/n/r/n You should seek immediate medical help if you suddenly experience these symptoms. /r/n/r/n Lexapro may also increase your risk of bleeding and bruising, especially if you are taking a blood thinner like Advil, warfarin, or nonsteroidal anti-inflammatory drugs, NSAIDs, like Advil and Motrin, ibuprofen, or Aleve, naproxen sodium. /r/n/r/n You should not take Lexapro if you have ever experienced an allergic reaction when taking escitalopram, the active ingredient of Lexapro. An allergic reaction might cause difficulty breathing, a rash, or swelling of the face, tongue, eyes, or mouth. /r/n/r/n Another serious side effect is increased suicidal thoughts in children and young adults. This is usually within the first few weeks of starting Lexapro or after a dose change. Lexapro should not be used in children under 12. Contact your healthcare provider immediately if you notice any sudden mood changes. /r/n/r/n if you or someone you know are having suicidal thoughts, dial 988 to contact the 988 Suicide and Crisis Lifeline and connect with a trained counselor. If you or a loved one are in immediate danger, call 911. /r/n/r/n Lexapro belongs to a large class of medications known as antidepressants. Lexapro is approved by the Food and Drug Administration, FDA, for short-term and long-term treatment of MDD and short-term treatment of GAD/r/n/r/n This medication works by increasing how much serotonin, a neurotransmitter, is available in the brain. Serotonin is involved in many processes of the body, including memory, sleep, and controlling internal body temperature. How much serotonin you have can also affect your emotions. /r/n/r/n Lexapro also has some off-label uses and may be prescribed to treat obsessive-compulsive disorder, OCD, and panic disorder, PD. /r/n/r/n Lexapro is an antidepressant SSRI used to treat depression and anxiety disorder. /r/n/r/n Side effects are common, especially in the first few weeks of starting Lexapro. However, as your body adjusts to the medication, side effects like dry mouth, decreased appetite, and nausea, among others, should resolve. /r/n/r/n Severe side effects you may experience while taking Lexapro are serotonin syndrome and an increase in suicidal thoughts. You should seek immediately medical care if you notice signs of either. /r/n/r/n Lexapro may help improve your sleep, appetite, and energy levels within the first 2 weeks. However, it usually takes 4 to 6 weeks to experience the full benefits of Lexapro. It is important to continue taking your medication as directed unless your healthcare provider tells you to stop. /r/n/r/n The author would like to recognize and thank Cody Ryan Thomas for contributing to this article. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.